I'm Casey Hansen. I work as a family physician out at the Goldsboro Clinic. And so I work taking care of patients in the outpatient clinic and also taking care of patients when they're sick and in the hospital. And I've been working here for 6 years. So those of us who are working in primary care have been using the lean process since January. On the one hand, we really are trying to cut out waste and make processes more efficient, but on the other hand, we have other more important goals. The main goal being assuring that each of our patients gets the highest quality of care. We chose 20 areas where we could work on improving things. One of the neat things about a lean process is that it really values respecting every member of the process. So it's important to have people from all the different areas of the offices there. By creating processes that are the same in different offices, we can help each other out. Someone can work at a different office and they still understand the same processes. And I think we can also learn from each other, and we've done a lot of that. There are things that work great at the Goldsboro Clinic. There are things that work great at Ellsworth Family Practice and Ellsworth Internal Medicine and Southwest Harbor, and we've really been able to learn from each other. And you know, you hear a lot of, oh, I didn't know that. Oh, I didn't know that could be done that way. So that's been really fun. And I think the next stage of this is to now roll out the changes and the processes that we've come up with. And we've had a lot of energy and a lot of excitement about them. And now it's a matter of bringing them out to the clinics and really ingraining them. And I think that will be challenging in some ways to create that kind of change. But I think we are lucky to have the support of an administration who really cares about making meaningful change that really helps our patients and really promotes an efficient and a positive work space.
My name is Gloria Green. I've been a nurse at Maine Coast for 7 years, and I'm a charge nurse on Med-Surg.
And my name's Tiffany Benner, and I've been a nurse at Maine Coast for 6 years, and I am also a charge nurse on the Med-Surg floor.
Kind of the theme of this year is kind of standardizing and making our practices more of the best practices, meaning practices that have been found to have the best outcome for the patient. And we've been working on congestive heart failure and diabetes and MI, pneumonia, all of those. There are certain things that have been found to improve patient outcomes when you meet those goals. And we have been working really hard to make sure that we are hitting every goal every time so that every patient gets the care that they need.
So we changed our entire diabetes management system in the hospital to what we now call glycemic control. And all patients are managed based on a standardized guide. We have seen a vast improvement in the range of blood sugars that we tend to see with the patients, or the varying that we see. That's almost null and void now. People kind of keep this nice even keel, which is the best way to help them heal, whether, again, it's from infection or recover from surgery or whatnot.
I enjoy taking care of people. I enjoy helping them when they're sick. I enjoy helping them to recover from, whether it be a surgery, an MI, pneumonia, whether it's seeing them grow stronger every day, whether it's seeing them get the tools they need to manage their disease at home.
We have the communication tools, which makes transition from shift to shift, or communication between staff members or providers more efficient, which makes just the basic bedside care more effective.
My name is Cameron Bird. I'm the nurse manager of the emergency department at Maine Coast Memorial Hospital. I've been an employee of the hospital for the past 6 years. The emergency department at Maine Coast Memorial Hospital has always provided exceptional care for that single moment that the patient came to us. I think recently what we've started to do is look at data. We've started to look globally across the organization to figure out exactly how we can best provide care for that patient. We're partnering inside the organization with the physician practices and other areas, as well as organizations outside of Maine Coast Memorial Hospital, to try to provide the best care possible for that patient. There was a small population that was having some significant usage of the emergency department, and I think what we really did was try to address what the issues were that were causing people to return to the emergency department. There were some specific issues that we were able to resolve very quickly. Providing the right kind of care at the right time, at the right place, has allowed patients to be able to access the care that they needed more efficiently, more cost effectively, and for all intents and purposes, everyone regarding the care is much happier. There's always been this anecdotal impression of the way things run in the emergency department. Now what we're doing is collecting data so that we have evidence to support what we kind of knew as nurses all along. And there have been many things that we've found that we were correct about, but there were some surprising things that we discovered we were absolutely wrong. So we're definitely looking at emergency department throughput. We're looking to see where our bottlenecks are so that we can get patients in, seen, treated, and out the door as efficiently as possible. That doesn't mean we want to sacrifice very good care. We're trying to do this all in an efficient manner to help patients who need to come to the emergency department get the care they receive as fast as possible, but also to help the organization bring patients in, treat them, perhaps admit them, and have that process go as smoothly as possible.
Hi, I'm Bruce Beck. I'm a staff nurse in the operating room at Maine Coast. I've been at Maine Coast for 15 years and been in the operating room for 12 years. And about 4 years ago now, I started the Green Team. I'm really excited about Maine Coast Memorial Hospital's endorsement and support of the Green Team and our efforts, because that means we're joining a growing national and international movement to make the delivery of healthcare more environmentally sustainable. And environmentally sustainable means we're conserving resources, we're conserving energy, we're throwing fewer things away in the landfill, and therefore we're taking better care of the planet. One of the primary principles the Green Team wants to bring to Maine Coast and the community here in Ellsworth is that there really is no difference between taking care of our patients here and taking care of the planet. We're launching our newest campaign. It's called 10-5-5. We would like to increase the amount of recycling we do by 10%. We would like to decrease energy consumption within Maine Coast by 5%. And we would also like to enhance chemical safety within the hospital. Our team is made up of volunteers from throughout the hospital. Everyone comes from a different department, and therefore everyone brings their own expertise and perspectives to the Green Team. The recycling program is an example of a true team effort here at Maine Coast. This is not just one person or one small group of people going around collecting all the recycling materials. All the employees are on board, and we look forward to generating more and more enthusiasm for that in the coming year.
So I'm April Bellotti, the Food Service Director, 7 years at Maine Coast Memorial Hospital. We have been investigating the whole local produce, and local I mean Ellsworth, Hancock, Goldsboro areas. We are trying to accomplish some healthy options as well as vegetarian options. Just also introduce some new foods that people aren't quite used to that are healthy. Really, it's exciting. It's more engaging for all of us, actually, too. Our staff, the response to this has been excellent, actually. They are very engaged with what they're doing and have great ideas. It's fun because you kind of have everybody together and we all talk about what we're doing and what we could do, and so it's really kind of exciting. Everybody gets, right into what they're doing, and everybody takes a lot of pride in what they're doing. Maine Day at Maine Coast. It was a hallway meeting, 5-minute hallway meeting. Heather Fowler and I had just a quick little idea, and I just ran with it. I thought it was a great idea to do Maine Day at Maine Coast, and so we decided to put our hands on 500 pounds of lobsters, as well as we did Simon's corn, because everybody loves their corn on a cob, so we waited for that. We did Dickens blueberry pie that day, so everything that we did that day was completely local. So we thought it would be a great, fun thing to do, and actually the staff had a great time doing it as well. At the end of the day, we're able to really support our local community. We're able to provide healthy options in the cafeteria. We're able to provide the healthy options as well to our patients. We're proud of what we do every day. So.
I'm Mark Polite from Stanley Subaru, and I've worked very hard to know the hospital but not be in the hospital at Maine Coast Memorial for the last 9-10 years, ever since we've been here. We've done a lot more with True Health than I ever imagined we would going in, and it forced us to think about what is True Health, and that's a pretty broad topic. We have had contests for changing lifestyle patterns. We've had incentives for taking a walk. We've had incentives for getting out and exercising, for being a bigger part of our community. But beyond the physical wellness, we've had a lot of mental wellness ideas that have come to light. We have a cheerleader in-house in Jeannie, and she's done a fabulous job to bring us the opportunities and the ideas and the excitement, but that screening and for people to get their stats and start to ask hard questions, I think was the push that a lot of people needed to say, okay, I need to do something, what can we do? And the wellness program gave the answer to the what can we do questions we had. Wellness in the workplace sometimes is hard to quantify, and everybody measures weight or they measure vitals, and they think that that's what it's about. But the benefits that we've seen really extend beyond that. And the big surprise benefit was people's attitudes and their excitement and their energy levels. They've come to work kind of with an extra spring in their step and a little renewed sense of self-worth. And that translates to how they do their job. It translates to how they interact with customers. It makes it a better place to work. The business of doing business every day can be overwhelming, and the time and the commitments that you already have in place can make something like a wellness program seem overwhelming. But like so many things in life, if you dedicate a little bit of time and a little bit of energy to it, the reward is greater than the investment.
So our patients can be dropped off here under this canopy that covers the whole front entrance of the hospital. This driveway has been widened, so 2 cars will be able to come around. The patient will be dropped off, enter this glassed-in entryway. This is our welcome center where patients will check in with Susan and Melissa. There is a sculpture of some sort, a metal sculpture being done here that's called the Tree of Life. Then we have 4 exam rooms. One.
Good size of exam rooms.
And this is the nurse intake, so she could weigh them, measure their height.
That's a little bigger than what we have now.
Yes, and she won't be in your way when you're zooming around.
I won't have to walk around the hall, maneuver around her in the hallway like we do now.
Exactly.
Good. Well, this will be quite different from what's available right now for the infusion.
Oh, yes.
This will.
To have the privacy to, whether that's just your personality to be.
Well, there are always
private
some patients who want that privacy.
Yes. This will be 3 communal infusion spaces, but the garden will be out front, all along the front of this, and I think there's some on the side.
Those are big windows?
Those are big windows.
Wow, those are
huge windows.
Wow, huge windows.
I don't think we'll ever use a light bulb.
Wow.
In our nurses station, which is huge, about the size of our old infusion room.
Wow.
Isn't it? This is the nurses' med room, so to speak. The chemo will actually come through a special airlock, because that's our pharmacy right through there.
Well, the good thing is we're still taking really good care of our patients wherever they are, but when this is ready, it's going to be a great addition to the hospital.
I don't really think anyone could totally understand how much this means to our patients and our staff to have this wonderful state-of-the-art facility to deliver the kind of care we deliver. Can't thank our donors enough for making all of this possible.
It's been a great community effort. I'm very impressed. And it's going to make a huge difference. The patients we have are so ill and need so much attention. This is going to be a great place for them to hopefully thrive and do well.